Hello, I'm Dr. Ruby Varghese, working as a family physician at Season 2 Senior Living. Today, I would like to share a few information about dementia. Dementia is an umbrella term under which comes different conditions which is characterized by progressive loss of memory and thinking ability, so much so that it affects the quality of life. So the conditions that come under dementia are Alzheimer's disease, vascular dementia, Lewy body dementia, then you have frontal temporal lobe dementia and mixed dementias. Now you may have a question, is dementia curable? The answer is no. So far we haven't found a cure for dementia. However, there are certain drugs which can help slow the progress of the disease. Now there are some risk factors for dementia. Number one is age. As age progresses, probably this is the price we pay for longevity. As you age beyond 65, the chances of developing dementia increases and we cannot do anything about it. Second is genetics, especially people with Alzheimer's disease can have a genetic predisposition to the illness. But there are some other reversible conditions over which you have power to control, and those are diabetes, hypertension, that is high BP, dyslipidemia, that is high cholesterol, and hypothyroidism. So these, if it is uncontrolled, can speed up the progress of the illness. Now, let's talk about the symptoms of dementia. Many of us may be having our dear ones who suffer from the illness. In the early stage, it is very, very difficult to identify it. The symptoms may be very, very subtle. For example, people may forget where they have kept their glasses or their dentures. It may be difficult to dress up, put on the buttons. They may be dressing up inappropriately. Then, they won't be able to make their own food. Sometimes they leave things on the stove and go away without forgetting completely about it. You may forget the car keys. And you may have difficulty in the language, finding the right words to speak. You forget people's names. You forget people. And you may have had breakfast, but still you keep asking for breakfast. Oh, give me water. She didn't give me water. She didn't give me food. Please give me something. So this may go on and on and on. They may repeat the same thing over and over again. Then they may lose their way. There will be, as the disease progresses, there will be a problem with walking. It may be a slow stepping gait. Sometimes it may be a shuffling gait. And all these abnormalities in walking can increase the chance of falls. So we should keep their rooms clutter-free and properly lighted so that the chances of falls decreases. There may be disorientation to time and place. They do not know the time of the day. And so it is very important to have a clock and a calendar in the rooms of patients with dementia. There may be change in moods and behaviour. Someone who was extremely nice and gentle may suddenly become very aggressive. They may have hallucinations, and the brunt of all this is taken up by the family who takes care of the patient. There may be times when the person with dementia will say that, they have lost something and the caregiver has taken it, and it can be very hurting. And it is very important to understand that it is because of the illness and it is not because you've really done that and the person is blaming you. So you need to have a lot of patience. So with dementia, it is not only important to take care of the patient with dementia, but also the caregivers. And in our community, usually the caregiver is either a spouse who is as old as the patient, maybe a couple of years older or younger, or it is a daughter-in-law, or someone else in the family. And it is a great burden. There is something called as a ZARD score where you can assess the caregiver burden. The higher the score, it is time for the caregiver to take a break. So it is here that organizations like Season 2 Senior Living come into play. We take care of a lot of dementia patients. Sometimes both the couple come and stay here while us, and we take care of both of them. Sometimes, because the caregiver needs a break, they can leave their dear ones with us for a week or two and go and take a break, which is very important because before they themselves reach a breaking point. Here at Season 2, we engage our dementia patients in various activities. So our brain is a bundle of electrical circuits. If you don't use them, it is like a path, it is like a road. If you don't use that path, it gets overgrown with grass and weeds. Similarly, if these circuits are not used, they slowly degenerate. So it is important to keep these circuits active, and that is what we do with our dementia patients, or all the elderly, all our residents. We engage them in a lot of activities. Memory games, group activities, yoga, sudoku, jigsaw puzzles, and so on and so forth. You can make them count backwards from 100 backwards, skip counting, and all these things help in keeping the circuits in the brain active and slow the progress of the disease. A very important thing in patients with dementia is that they do not like their environments to be changed. Any change in their environment can trigger an aggressive mood. So it is important to keep the environment sane and safe. Even meeting strangers can aggravate their symptoms. So it is important not to keep changing their caregivers very frequently. And never argue with patients with dementia. They may tell you that the sun rises from the west. Say yes, it rises from the west. They haven't given me food. I'm hungry, please give me food. She won't feed me, she has eaten up my food. You just say yes, it's okay, I'll give you some more breakfast. So you need to be very, very gentle in handling them. So, and that is what we do here at Season 2. So if you have a dear one with dementia, and if you want help, you can always reach out to us.